Hi, my name is Aleksandra Rachitskaya, and I'm a retina specialist at Cleveland Clinic Eye Institute. What is diabetes-related retinopathy? When we think about diabetic eye disease, it affects the back of the eye the most, your retina. And retina is very important because we only have one retina, you can't replace it. And the retina is part of the eye that gathers all the visual information and then sends it to the brain. So if the retina is damaged from diabetic retinopathy, your vision is not going to be good. The way that diabetes affects the retina, it damages the blood vessels that can lead to different manifestations such as swelling in the retina, lack of blood flow in the retina that causes the retina not to work well, or you can have more advanced manifestations such as bleeding in the eye or even retinal detachments from diabetic eye disease. What causes diabetes-related retinopathy? The two biggest drivers is your past history of sugar control, gift that keeps on giving. So if you had high sugars 10 years ago, there might be manifestations of that sugar in your eye. The other big aspect is your current sugar control. We can't change our past, but we can work on controlling the sugar the best we can for the future. The other conditions that are more serious if you have other problems, such as if you have high blood pressure, let's say, or if you have kidney disease or heart disease. What are the symptoms of diabetes-related retinopathy? So the most common symptoms are distorted vision, blurry vision, feeling like there's a lot of floaters in your eye. The bleeding will look like that. Not be able to read clearly or see the faces of people in front of you or be able to drive. Very rarely people have discomfort or pain. The most dangerous thing about diabetic retinopathy is that patients might not have symptoms even though there are changes that are happening in their eyes. Some patients might have actually quite severe diabetic eye disease, but still see clearly in the center, because sometimes diabetes affects the peripheral vision and we might not realize that there are some changes happening until the center is involved. What are the treatments for diabetes-related retinopathy? The kind of big buckets of treatments that we have include injections in the eye. And although those sound scary if you've never had an injection in the eye, that can be very, very effective. There's also laser treatment. This is treatment with the laser to the back of the eye, the retina, to treat the complications of diabetic eye disease. And finally, some patients do require surgical intervention for us to take a patient to the operating room and actually work inside the eye with the surgery. What is the prognosis for diabetes-related retinopathy? We work really hard to maintain vision in patients with diabetes, and with regular follow-ups and potential treatments, you can have good vision even if you have diabetes. First, it's very important to control the systemic risk factors. So sugar control, blood pressure, triglycerides, cholesterol, all of those aspects. And we work with either their primary care doctor or endocrinologist because it becomes a team approach. That said, diabetic eye disease in its advanced forms can cause blindness. So it's so important for patients who have diabetes to get regular checkups, even if they don't have symptoms, because some of those manifestations I mentioned don't give you symptoms right away. But when your doctor looks inside your eye, they'll be able to see if there is beginning of diabetes in your eye. Is there any way to prevent diabetes-related retinopathy? We, as retina specialists, very strongly recommend that if somebody has a diagnosis of diabetes, either type 1 or type 2 diabetes, they undergo regular screening exams with an ophthalmologist to make sure that there is no manifestations of diabetes in the eye. I always tell patients diabetes is a chronic disease. It's a condition that will persist for the rest of your life. And so when it comes to the eyes, we become friends. I see my diabetic patients frequently, and I see them for the rest of their life because the effect on the eye continues.